with the safety guidelines for protection against the coronavirus. We are so fortunate to have with us today key medical experts in the field of immunization to give their insights, guidance, and recommendations on immunization amid the pandemic. We would like to welcome this morning Dr. Wilda Silva. She is hold on. She's the program manager of the Department of Health's National Immunization Program. Dr. Lulu Bravo, the executive director of the Philippine Foundation for Vaccination, and Dr. Mary Ann Bunye, the president of the Pediatric Infectious Disease Society of the Philippines, or PIDSP. So good morning to all three of you, and thank you for being with us here today. We'll start with your opening statements. We'll start with Dr. Silva.
Morning, Joyce, and good morning to everyone who is listening right now. Let me start by saying that immunization is really an essential healthcare service. And despite this COVID pandemic, it should not be stopped. Delivery of immunization services must be continued because vaccine preventable diseases will happen if we stop immunization, and it will further overwhelm the already overwhelmed healthcare systems because of the COVID pandemic. Back to you, Joyce.
Okay, thank you, Dr. Wilda. And now we'll have Dr. Bunye for her opening statement.
Hi, Joyce. Good morning, and good morning to everyone. PIDSP, together with the Philippine Pediatric Society, have been avid supporters and strong advocates of immunization. We have felt and experienced that vaccines work. Through the years, these vaccines as health tools have been tried and tested, kept everyone healthy, and known to be the most cost-effective intervention in protecting children from being hospitalized and dying from these vaccine-preventable diseases. We realize that we are in the midst of an invisible, dreadful enemy. We don't have yet the magic bullet for that. However, this should not deter, scare, or even discourage us in continually providing our stakeholders basic health services like immunization. Let's all recognize that each opponent virus that we encounter has its own weapon. This coronavirus has its own. Measles, polio, pertussis, flu all have its own effective weapon of infecting vulnerable individuals, especially children. So sa ngayon, meron na tayong mabisang bala para sa tigdas, polio, tuspirina, flu, pulmonya, pagtatae, at iba pang mga sakit. So labanan natin at sugpuin natin ito upang mapanatili nating malusog ang ating mga bata. Sama-sama, tulong-tulong tayong ihayag sa mga magulang kung gaano kahalaga ang magpabakuna. Salamat. Back to you, Joyce.
Thank you, Dr. Bunye. And for our last opening statement, we'll hear from Dr. Bravo.
Hello, Joyce, and hello to my very good friends, Mary Ann Bunye and Dr. Wilda. This is really a very opportune time to talk about vaccines in the midst of this COVID. And the Philippine Foundation for Vaccination has prepared a 5-minute video, which actually encompasses all the Department of Health and the PIDSP, that's Mary Ann's presidency, during this time, to present to you this kind of video. And if Joyce and Chito can present this is really what I wish to say to our journalists and to our media people. So,
thank you, ma'am.
Take it away.
Hi, I'm Dr. Lulu Bravo, Professor Emeritus of the UP College of Medicine. I'm here today to share with you some important messages which the Philippine Foundation for Vaccination, together with PIDSP, the Philippine Pediatric Society, and the Department of Health have put together during this time of COVID-19 pandemic. We are at a time when we are all scared because a new disease, deadly and easily transmissible, with no vaccine yet, has spread, and anyone can get it. We have lost friends and family members and healthcare frontliners because of this. But please, let us not forget that there are other diseases that our children and loved ones can also suffer from if they do not get vaccinated. These are measles, polio, diphtheria, pertussis, pneumonia, diarrhea, influenza. And let us all be reminded that first, if children and other vulnerable population are not vaccinated, they can get sick and can die from these vaccine-preventable diseases. Second, our Department of Health has a national immunization program that gives our children free vaccines to improve the health and take care of our population. Listen to our Department of Health. Thirdly, vaccines have saved countless of lives. In fact, 2.5 to 3 million lives are saved every year from vaccines. And the same thing happens in the Philippines. If you remember, we achieved MDG 4 in 2015, which is the reduction of childhood mortality. Mostly, this is credited to vaccination. Now, if we do not vaccinate, and this is message number 4, these diseases that have disappeared will quickly reappear, and we can again lose our children. Just look at what happened last year with the measles outbreak that killed 500, mostly children. You know, we have already achieved 0 measles death in 2005 to 2010. Now, people are sometimes afraid of vaccine because of side effects or perceived harm. And this is message number 5. Remember that when vaccines are approved for use by regulatory bodies, it has gone through all the steps and phases of testing and clinical trials for safety and effectiveness. Risks will be too small and very rare. Vaccine benefits always far outweigh these risks of vaccination. Now, when a country will not take care of preventing these infectious diseases, message number 6, these countries will suffer not only from health issues, but from economic disaster as well. Just look at what's happening to COVID-19 pandemic. It has completely devastated both rich and poor countries. People are really now trying to develop the vaccine as fast as possible for COVID-19. Now, remember, message number 7 is please have yourself, your kids, your loved ones vaccinated. Don't let those vaccine-preventable diseases come and increase the burden that COVID has already produced in our country. The last message is that we can all work together to disseminate and advocate for the protection of our children, our people, and our country. Please ask your pediatrician, your doctors, how to get the vaccines needed in this very difficult time. Let them be protected from vaccine-preventable diseases. Thank you very much.
Thank you for that, Dr. Bravo. Those are very, very helpful information. So, just to recap a little, So Dr. Wilda earlier said that, because of the pandemic right now, uh, this has been overwhelming our already overwhelmed healthcare system. But according to Dr. Bunye, vaccine remains the most cost-effective way to prevent diseases. And this pandemic should not deter us from pursuing our vaccination program. And I like the analogy that she gave earlier. Sabi niya, each virus has its own weapon of infecting us, pero meron din tayong sarili nating bala to counter or to counteract or to fight back against these viruses, which is our vaccination program. And Dr. Bravo talked about how right now this is actually the most opportune time to be discussing about vaccination. Uh, Children who are not vaccinated are at high risk of getting sick and even dying. And vaccination has proven to save lives. 2.5 million deaths globally each year ang napaprevent because of vaccination. And also, she underscored a very important example to highlight the need really for vaccination. Last year, we had a measles outbreak, and at least 500 people, 500 Filipinos died because of the measles outbreak, mostly children. It's unfortunate because since 2005 to 2010, we already had zero measles cases, yet we experienced an outbreak again last year. Okay, so to our esteemed colleagues in the media who have joined us today, please field your questions via the Q&A tab below your screen. And before we open the floor to questions from our media guests, let me ask first a few questions to our panelists. For Dr. Wilda, there. Hi, ma'am. Can we reinforce with clarity if the government's position through the DOH is to promote the continued vaccination while COVID-19 is still ongoing? And have there been changes in the government's program for vaccination given the pandemic, if any?
Issued a guideline on how to continue with the immunization, routine immunization despite the COVID pandemic. While our position is immunization is a core health service that should be prioritized even at this time of COVID pandemic, we we also accept the fact that we need to protect our health workers and our community as well. So we have to strike that balance between giving that life-saving vaccine and protecting children against vaccine-preventable disease, and also protecting our health workers and community against COVID. So the position of the DOH when the COVID crisis was at its height was to offer immunization services when feasible. So we asked the local government unit to do a weekly analysis of the COVID situation on one hand and the vaccine preventable disease situation on the other. If the COVID crisis or the COVID situation outweighs, the risk that the COVID can give outweighs the benefit of giving the vaccine, then the decision is to temporarily suspend vaccination. But if vaccine preventable diseases risk is very high, then we have to go ahead and provide immunization services and at the same time protecting our health workers by employing strategies like wearing PPEs, imposing social distancing, frequent hand washing, or sanitizing your hands with hand-based, alcohol-based rubs in between patients. So all of these measures have to be incorporated in the routine immunization services. But the decision or the position of the Department of Health is immunization should continue. And strategies on how to implement this will be dictated upon how much is the risk of COVID-19.
Okay, thank you, ma'am. I think that's very reassuring to hear that, the position is that immunization should continue, but of course, we're striking a balance between ensuring the health of our healthcare workers while continuing with the immunization. But this is a follow-up. Is the government on track with the vaccination program calendar? And we have enough supply? Because I read that for child pneumonia, for example, the tender is still being assessed by the Health Technology Assessment Council. Do we have updates on the PCV review by HTAC?
For the PCV, the pneumococcal conjugate vaccine, we do have enough supply until August this year, 2020. And we are hopeful that HTAC will release their recommendation uh, anytime soon so we can proceed with the tender.
Okay.
And for other vaccines, yes, we do have enough supply of vaccines at the national store in RITM in Alabang. However, our challenge is the distribution from NCR or from RITM, our national store, to the different regional stores. You know, because of this COVID pandemic, chartered flights were, commercial flights were canceled, and this is really a challenge on how to distribute these vaccines up to the implementation level. But we addressed this. We partnered with other agencies like PNP to make sure that these life-saving vaccines reach the intended beneficiaries. Back to you, Joyce.
Thank you, ma'am. Yeah, we acknowledge as much. It's really a challenge to do distribution right now from RITM to across the country because of the pandemic. For Dr. Lulu, ma'am, our question is, how has COVID-19 changed the way we address vaccination as a whole, given the pronouncement that coronavirus may already be endemic and it would be with us for a very long time?
Thank you very much, Joyce. And thank you for our journalists who are here. I was reading your questions, and it's all about actually what has been the effect of ECQ on our immunization services. You know, I was talking to our midwives just the other day, and they are telling us that indeed it has really decreased from a high of almost 90% last year when we were doing the measles immunization house to house. Now it's really going down again. And in some areas, I was told in non-Luzon areas, like in Zamboanga, in Mindanao, it's still a little bit higher, more than 80% coverage. But here, I'm sure Wilda can tell us most of this, but it has really gone down to even less than 30%. And I'm working in Las Piñas and in Pasay. You know, I've asked the midwives there, who are now the frontliners, by the way, in our health centers, because they said the nurses are going out to the COVID areas. The midwives actually are a good source of information, because right now they're really saying that it has really gone down to almost just 20%. And because they cannot actually do the same thing they were doing before, like, di ba, may physical distancing tayo. So every day they only have to cater to, like, say, if they were going to immunize, they can only cater to like from 2 to only about 5 per day. So it has really remarkably decreased. And house-to-house campaign has been one of the possibilities. Of course, I know, Wilda, I have shown some pictures of your health centers where you use the gym or the basketball court for, you know, physical distancing, for patients to be there and able to get the consultation or immunization. But there is now a way for midwives and for our health center physicians to, let's say, schedule them, like in the morning they could be immunizing, and then in the afternoon they could be doing consultation. I know for a fact that mothers, even both private and public, are really afraid of going into health centers, hospitals, just to get immunized. But I'm sure they will also be able to get information, not only from their doctors, but also from their health centers, barangay health workers. You know, I've worked with barangay health centers, and they are also a good source of information. And that's the reason why we have to educate and also train our midwives, our barangay health workers, to actually tell the parents that don't be afraid, because even children need to be vaccinated at this very difficult times of COVID. Because even if children, oh, by the way, we should also say that there is less morbidity among children with regards to COVID. And it's the elderly who are really getting the brunt of this burden of COVID. So the children actually needs to be really immunized, because they are more at risk of getting measles, polio, diba? Tumataas na naman ang polio natin. I'm sure this is actually what I'd like to ask Wilda, because of the ECQ, I'm sure some of our immunization program, even in the far-flung areas, have really decreased. So let's talk about how we can build up this confidence that we have been trying from the Philippine Foundation for Vaccination. We have been really trying to actually increase that vaccine confidence that our mothers have, and our health workers even. Because I know, Wilda, you remember when we did a sort of a rough survey among our AMHOP in Baguio last year. Even the AMHOP officials, the municipal health officers, have actually shown a decrease in their vaccine confidence. So maybe, yeah, we need to ask even Dr. Mary Ann Bunyi how the private pediatricians are doing it to engage the mothers to really get them to be immunized. This is a very important issue. Thank you.
Thank you, ma'am. Thank you. Just as a quick follow-up question, have there been can we see that what have we been learning from this pandemic in terms of ensuring a robust vaccination program?
Well, is it directed to me, Joyce? You said a follow-up question?
Yes, ma'am. Yes, ma'am. That's for you, ma'am.
Right. Actually, as I initially learned from our midwives, because as I said, I was talking to them, they have only like 10 to 20% that they were catering now to immunization. And as Wilda mentioned earlier, some of the health centers have to close because they found a positive COVID patient in the health center. But in others where it is still COVID-free, they're doing physical distancing. They're using the PPE, by the way. I have pictures of that. Sorry, I did not bring it. But, they have marvelous PPEs. They know now among the midwives, they're wearing their face shield. And, there are levels of PPE. The level 1 is for those who are not doing patient care. They only need the surgical mask, right? But for those who are taking patients or seeing patients, they have to wear at least level 2, which has the face shield. And of course, there's also the gown that is either washable or disposable. But if they are going to use procedure, they have to use gloves. Like if they have to immunize, then they have to use gloves, in addition to the face shield and the surgical mask. And I think if mothers know that, the health workers are also trying to decrease the transmission of disease. And by the way, patients are also asked to wear surgical masks, not the children, but the mothers when they come to the health centers, right? Maybe Dr. Wilda could expound on this much better.
Okay, ma'am. We'll ask Dr. Wilda to give her inputs later. But just to summarize, if I move on to Dr. Bravo, you mentioned very important that, it's unfortunate that our immunization percentage is going down, less than 30% in certain areas, because, the people have this fear of going out, of going to our health centers. Also, it's very important to note, you mentioned that midwives have now become frontliners as well. Salute to them. And there's really a need to increase our vaccine confidence right now. Actually, we're receiving several questions, but for Dr. Mary Ann first, there's a recent quote from another expert that says that while COVID-19 continues to infect hundreds, thousands of people from other vaccine preventable diseases, what what are these top vaccine preventable pediatric diseases that parents should be aware of?
As I've mentioned earlier, di ba meron tayong measles? We have had measles outbreak last year. We have pertussis. We have flu. We have pneumonia and even diarrhea. So all these vaccine preventable diseases, we have vaccines for that. So from the PIDSP standpoint, mas maganda sana na mabakunahan itong mga bata because we have the vaccines for that.
Quick follow-up. Pediatric pneumonia is a top killer disease for children 5 years old and below. Does this continue to hold true right now? And if
Yes, it
so,
does.
yeah, it's the vaccination for pediatric pneumonia. It's one of the programs that we are pushing for. Do we have new data on this?
Regarding what about, ma'am? Yung if it
Vaccination
still remains to be.
for pediatric pneumonia.
We have before, I think the DOH had PCV, that's pneumococcal conjugate vaccine. And pneumococcus is one bacterium which can cause bad pneumonia in children. So we have that.
Okay, ma'am. Thank you so much for that. For our panelists, we will now move on to the questions sent to us by our media colleagues. Actually, madami na po sila. Okay. So we'll start with line. We'll start with Mr. Joe Vicky from the Philippine Daily Inquirer. His question is for Dr. Wilda. Has the DOH seen a drop in the number of children getting vaccinated since the ECQ was imposed? Or is the current number similar to last year's? Are house-to-house campaigns being done by our barangay health workers? Are house-to-house campaigns being done by barangay health workers to reach our target kids?
Hi, Javik. Thank you for your question. Yes. Actually, I was trying to answer the question in the chat box. There is a disruption in the delivery of immunization services at all delivery points. So whether the disruption is great or small, we do not see a uniform disruption in all of the regions. But I can share with you that in Q1, that's January to March, and even towards the beginning of May, we have seen an all-time low of 7% for our fully immunized child coverage. And this is very low because of the disruption, both from the supply side and the demand side. Parents are afraid to bring their children to the health center, even if the health centers are open for immunization services. And in other areas, health centers are completely closed, either because they fear they are afraid of COVID-19, or our health workers are being pulled out to assist the COVID efforts. So all of these disruptions are felt all over the country. So as I have said, it reached an all-time low of 7%. We haven't experienced this number for a very, very long time. We had experienced vaccine hesitancy in the past, but 7% is really very low because of this COVID crisis. And yes, I can say that in some parts of the country, ECQ actually worked in their advantage because children are at home. They are not allowed to go out, mothers as well. So other health workers are doing integrated community services, like they are offering immunization, they are offering family planning services, they are delivering TB drugs at the doorstep, And all of these services are integrated in one. So they do door-to-door vaccination as well. And yes, ECQ work to their advantage. But this is not true all over the country. So in some areas, there are good practices amidst COVID pandemic. But in some areas where the threat of COVID is very high, then immunization services has to be temporarily discontinued in order to give way to the COVID efforts. Thank you.
Just a quick follow-up to provide lang context. When we say that 7% is low, where do we compare this? What's the year-on-year difference, or prior to ECQ, what was our average?
Our average prior to ECQ is 16%. Although this is still very low because the target every quarter should be 23 to 24%, so that at the end of the year, we reach the 95% or higher. So 7% is very low.
It's like a decrease of more than 50%
Yes.
from 16%, which is already low at the low end of the target. Thank you, ma'am. Our next question is from Sheila Crisostomo of the Philippine Star. Is there an outbreak clustering of measles or polio now? What is the DOH doing now to catch up, aside from calling on LGUs to scale up on their vaccination activities?
Thank you, Sheila. Yes, we are experiencing clustering of measles in some of the areas, in some of the regions, particularly down south. If you remember, early this year, before the COVID pandemic was announced, we saw an increasing number of cases in some of the areas. That's why as early as January, we issued an advisory, a memorandum for all regions, especially the high-risk areas and areas with ongoing measles transmission, to quickly do an outbreak containment or an outbreak immunization, so as to contain this small number of cases. We've done that for Region 3, Region 5, and some parts of Mindanao. But because of this COVID pandemic, some of the areas have to temporarily hold their vaccination. Now, we have continuously communicating, we are continuously communicating with our regional managers because we feel that there is some sort of a lull as far as the COVID cases are concerned. So right now, the tall order is for them to do catch up in all areas. Actually, there are two non-negotiable activities for DOH EPI right now, and this was well communicated to all of the regions. Number one is the continuation of the polio outbreak campaign for the whole of Mindanao and Region 3 and Region 4A. And the number two is the supplemental immunization activity for measles towards the end of the year. So these two we are planning because we need a good plan, putting into context all of this COVID response. So yes, those are the two non-negotiable activities for EPI in 2020.
Okay, ma'am. Thank you for that. For Dr. Mary Ann and for Dr. Lulu, two questions. One from Ms. Mears Roman. She said that, what do you advise parents, especially those in ECQ areas? How should they go about with the vaccination given the requirement for physical distancing and other protocols? And from Ruth Palo of Mindanao Daily Mirror, ito, importante rin siguro na what do parents need to show in checkpoints when they need to have their kids vaccinated?
Hi, Joyce. Ah, Joyce, sa pediatricians kasi, one of the problems that we encounter, ang challenge namin are parents who stay in ECQ areas. So, let's say for example, if I have a patient, nasa ECQ sila, I'm in the GCQ. So, travel issues ang problema. So, what we advise them is to look up their baby book and then tell us ano yung immunization history. And then we advise them to look for a clinic which is open in their area. And then talk to the doctor. If they have this vaccine, okay, let them receive the vaccine. Even in that area na lang. Wag nang pumunta sa amin. And then if there are open health centers which offer immunization services, then we also advise these parents to go in their barangay if their health center offers vaccination in that area, para hindi na sila nagko-cross coming from an ECQ to a GCQ and going back to their place, kasi medyo mahihirapan nga sila in terms of traveling, and then ma-check pa sila of whatever reason and then hindi makarating sa amin. That's it from the point of view of pediatrician.
Thank you, ma'am, for that. Dr. Lulu?
Yes, thank you, Marianne. Actually, there have been many talks, many webinars that have been put out. And maybe you can even see the midwives. And yesterday, Marianne was also talking about immunization in these COVID times. There is this new normal that we really have to be challenged with. As Marianne said, some doctors are even doing immunization, in the parking area of the hospital. When a patient would go on their cars, they are actually being given immunization. Doon mismo sa kotse nila, hindi na sila aakyat, hindi na sila bababa. And then there are also areas where the hospital provide a space where they are able to do immunization lang. Hindi sila sasama doon sa mga nagsisick baby. Actually, things are really getting to be kind of developing, mga guidelines. The principle is that we do not mix the well baby with the sick baby, so that the mothers will feel more confident when they go to the clinics, diba? It is evolving. I'm sure every day, the doctors, the pediatricians are now thinking of ways. Just like the Department of Health, Dr. Wilda is also doing this for our health frontliners in the health centers. But it is important to know that what Marianne said, maybe it's time we develop a telemedicine or a telehealth for immunization. And, some people who do not want to go to clinics anymore, like I am 70 years old. I really have thought I will no longer go to the clinics because I am at a risk, right? The elderly population like me will no longer do face-to-face consultation. But we are willing to do what we call now telehealth, telemedicine, teleconsult, whatever it is. It's now the time of this webinar. It's now the time when you can do teleconsulting. And those of you who really want to be immunized, you can get this telemedicine. And as Mary Ann said initially, they could ask where they can get their immunization. So this is something that is evolving. This is something that we have to develop. I said my pitch is always, let us all work together. The Department of Health, the private practitioners, the public, even the policymakers, the lawmakers, they have to also work together, even the businessman, even the LGUs. We really have to work together to ensure that our children are immunized. And by the way, it's not only the children that needs immunization. I saw someone asking the pre-adults, the adults, the elderly, do they need immunization? Of course. For elderly, we need influenza pneumococcal. That's under the law because they can also die from influenza. And if you have COVID and if you have influenza, I assure you that is much more deadly. That's the reason why you need to be vaccinated. Because if you get the two illness, the flu and the COVID, my God, that is really deadly. And you have seen that. Even pneumococcal disease on top of a COVID, which is a virus infection, that can also be deadly. Thank you very much.
Thank you, ma'am. Uh, Going back to the issue on pneumococcal diseases and vaccines, uh, the WHO said that the two PCVs in the market right now, PCV10 and PCV13, they have the same effect. Is this true? This is for uh, Dr. Silva. And the WHO has already said that what's stopping the DOH from offering both vaccines, especially if PCV10 is said to be a lot cheaper. Also, as a quick follow-up from Sheila Crisostomo, she's asking if there's already a decision or are we nearing a decision as to which between PCV10 and PCV13 will be used by the DOH.
Joyce, am I coming through? I can see here I'm muted. You can hear me? All right. I really don't want to go into details about PCV10 and PCV13 because this is at the moment evaluated by the Health Technology Assessment Committee. What I can say right now is, yes, it is in the hands of the HTAC. They are doing an analysis because you know that when you have PCV10 and PCV13, there are 3 serotypes in PCV13 that is not in PCV10. And what we want to know is, are these 3 serotypes not in the other vaccine, the prevailing serotype here in the Philippines? That's one thing that we want to know. Another is, yes, there is a recommendation or a position by WHO that even though the serotypes are not present in PCV10, there is some sort of a cross-reaction with other serotypes. But yes, we will defer to the recommendation of the HTAC. That's why EPI is waiting for the recommendation of this August body. Now, we have been vaccinating children against pneumonias 5 years ago. So I think now we will have a good evidence on the prevailing serotype here in the Philippines, and that is now all in the hands of HTAC to decide.
Just a quick follow-up. Rosel Toledo is asking if vaccination for pediatric pneumonia could somehow decrease the chances of contracting COVID, or at least make the children have a better chance of recovering should they get infected by COVID.
Just like what Marianne and Dr. Lulu mentioned, I think the risk of contracting COVID is more in the older age group. We haven't seen a lot of infants being infected with COVID-19. But since pneumonia is one of the killer diseases among the under 5 years old, so this is a very important vaccine. And when you talk about PCV, this is just one microbe that is causing pneumonia and meningitis among the under 5. You still have a lot of germs out there that can cause pneumonia. So I think it should be communicated to the parents that even though they receive the PCV shot, then there's still a possibility for the child to get pneumonia from other viruses and from other bacteria. And we also have another vaccine, the HIB, the Haemophilus influenza type B, also causing pneumonia, and this is also provided by DOH as part of its regular immunization program.
Okay, ma'am. Thank you for that. We have several follow-up questions here. Hold the line. I think Dr. Lulu can answer this one. From Lionel Makahilig, with the new normal scenario being more reliant on digitalization and mobile technology, does the DOH already employ or plan to employ these innovations to make the immunization program more efficient and reach more target beneficiaries?
Yes, thank you for that. I really am also excited to talk about telemedicine and telehealth. I know it's gonna be there. This is the new normal when people would rather be sure when they go to the hospital that they need to go to the hospital. And for immunization, they have to, because even if we have the house-to-house campaign where actually it's the, di ba, Wilda? It's the barangay health workers, the midwives who go to the house to actually give the immunization. It could also be very sort of uh, fatiguing. It can cause fatigue to our midwives, especially now that we lack a lot of personnel. They sometimes have to go to COVID areas. The nurses daw nga are not anymore in the health centers, but are being brought to other COVID areas. So magkakaroon ng fatigue ng ating mga health workers. So when you do your immunization, it has to be yung pasyente ang pupunta sa kanyang health center. Now, the thing is, for private practitioners, kasi ang mga nasa urban natin, sa mga barangays, kung minsan wala silang laptop. Or sometimes may Facebook naman. I don't know. It is really something that we really have to learn about. How can they do consultation using a cell phone, using a telephone, or using your laptop? I think this is the future. This is the way forward, to really ask the mother, or really the mother can ask you, the doctor who is now there on the phone. That is what we are doing now. I don't know, maybe Mary Ann can also say about this, because di ba nag-aaral na yung mga doktor ngayon kung paano mag-entertain ng mga pasyente through the laptop. Kaya nga sabi ko, kailangan ng mga doktor mag-tutorial na rin kung paano mag-telemedicine, mag-teleconsult. Because it will happen. I'm sure it will happen, where you can make decisions based on what you see on the screen. Nakikita mo, tingin ka sa mata, tingin ka sa bibig, tingin ka sa ilong, ano bang nakikita mo? Ano bang nahihipo mo? Ano ba ang symptoms ng baby? Of course, madali yung history taking, meaning to say, tinatanong mo lang. Pero yung pag-examine, yun ang medyo challenging, di ba? But it can be done. I'm sure, pediatrician ako of 45 years. I know that sometimes sa telephone lang nakakapag-instruct na tayo kung ano yung bibigay natin, di ba? So it is the way to go forward. And I don't know, ang Department of Health, maybe we can ask also Wilda, and of course Mary Ann, if anybody now is doing it. But I'm sure this is what is being talked about now in private clinics. So thank you. I hope Wilda and Mary Ann can also answer that.
Joyce, can I add dun sa sinabi ni Dr. Bravo?
Of course, ma'am. Go ahead.
Ganito nangyayari ngayon. Right now, we're setting it up, yung telehealth, televisits, teleconsults. But at the moment, my experience with my patients, dahil lahat naman ng patient o lahat naman ng individuals ngayon may cellphone. So what they do, they text me, Doc, may sakit po yung anak ko, may lagnat po for the past 3 days, may ubo po. At meron po ako nakikitang pigsa. So what I do, since may Viber yan sa mga telepono, sasabihin, can you send me an image through Viber? So makikita ko doon. And then, from that, nakakapag-advise ako doon sa parents. I think that's a rough way of doing teleconsult. Pero syempre, mas maganda pa rin if you can see it full screen and you can talk face-to-face using the screen of the laptop. But as it is right now, it works for me using the cell phone. SMS and then the Viber with the image.
Actually, ma'am, that happened to me last month because my mom, the both of us are diabetics. We needed a prescription from our doctor for our medicines, and then I just had to Viber him na, Doc, pwede mo humingi muna ng prescription, and then via Viber he sent it. And then showed it to Mercury Drug, and it's fine.
Yes, they accept that.
Yeah, they accept it.
Yes.
Doc Bunny, just a quick question from Sheila Crisostomo. What is the protocol if a child misses his or her vaccination schedule? Pwede pa raw po bang ihabol o dapat magsimula all over again?
No, hindi mo na kailangan simulan ulit. We have what we call this catch-up schedule. So kung let's say nasimulan mo siya the first time and you need to complete that ng 3 beses. So you consider the first dose kahit several months ago pa yon as the first dose. And then you just continue on until you finish the series. You don't need to start from zero.
Thank you, ma'am. For Dr. Wilda, ano lang po, ma'am, follow up lang po from Joe Vicky. Yung 7% po is the national average that you mentioned earlier. Iba raw po ba ang average for NCR? Is it lower or is it the same?
Oh, that is for the national average. I apologize, I do not have the regional breakdown, but it is really low considering na lahat ng regions nagkaroon ng disruption in the delivery of immunization services. And the digital platform, if I may continue from Dr. Lulu, DOH, ang limited lang siguro kami sa, calling the EPI managers and do our planning. We are now actually using this platform. We are not calling them anymore face-to-face, but rather doing just like this one, when we do planning and workshop and even provision of technical assistance. And yung sinasabi ni Dr. Mary Ann na may mga patients na nagdetect sa kanya, well, that is also what is happening now as far as the immunization program is concerned in some of the regions, because they do text their clients, especially yung mga masisipag nating mga health workers, our midwives, our vaccinators in the field. If the child missed the schedule at merong iniwan na number si mommy, then they text the parent to remind them na, oy, na-miss mo yung immunization, so you have to present your child in the health center for this antigen.
Doc Wilda, meron lang pong tanong si Mr. Monsi Serrano. He said, why does the DOH micromanage the situation when you're admitting that you have limited personnel? Hindi na po ba pwedeng LGU na lang ang magsagawa ng sarili nilang immunization program since they have their own health officers and doctors sa community?
It is the LGU who implements the policies from the national DOH. Ang nanggagaling lang po sa amin is guidance on how to operationalize the immunization program and of course the logistics. But all of the vaccinators are coming from the LGU. When there is limited human health resource in the LGU, because let's face it, sa LGU po, hindi lang naman po pagbabakuna ang ginagawa nila. All of the health programs, they implement that. So, kung kulang, and then DOH will now augment. It's actually the LGU implementing immunization. Kung may pagkukulang sa mga nagsasagawa ng pagbabakuna, then that's the time that DOH augments the human health resource of the LGU. But for the vaccines and other immunization logistics, those are all coming from the national government.
Okay, ma'am. Thank you. We have 3 questions that are related actually to COVID-19, not necessarily to the immunization program, but we'll ask them nonetheless. For whoever wants to answer these questions, from Ms. Nelly Lumbaca of Samahang Plaridel, will you endorse the use of locally sourced cures or vaccines or treatments instead of waiting for the availability of foreign vaccines such as remdesivir?
The remdesivir is not a vaccine, but it is an antiviral for the treatment of COVID-19. I am not part of the COVID team of the DOH, so I am not aware if there are locally available remedies or medicine against COVID-19. But for vaccines, I can say that we do not have a local manufacturing or vaccine manufacturing plant, either run by the government or the private company. I think yun ang wala tayo dito. So as for, if I may talk about the COVID-19 vaccine, I saw in some of the documents passed on to me that some of the companies are now in phase 2 clinical trial, but then this is a long way to go. We need to have an effective and a safe vaccine para natin maibigay sa ating mga community.
Thank you, ma'am. For other panelists would like to answer, otherwise I'll move on to our last two questions. Yes,
I'd
ma'am.
like to respond to that. And so far as could we use other drugs? Definitely, we should listen to our Department of Health's recommendations and the medical society's recommendation. Do not use things that are not really recommended by the authorities or by the experts. You see, there are many people who will take advantage. Oh, this is good, this is good, this is good. But they are not tested. They are not, even medicines, even vaccines, even whatever drugs, even coconut oil. It is needing testing and authorization from the experts. Do not use something that you heard from the neighbors. Kasi ganun tayo pagka medyo, di ba? Pag medyo kabado na kung ano-ano. I think right at this moment now, the most important, most effective way to prevent COVID, wash your hands, don't touch your face, physical distancing, social distancing, okay? Use masks if you are going out. Use all of these gloves if you have to check your patients, and make sure that you disinfect all the surfaces and all the things that you wore outside. When you get into your house, make sure you do not get those outside clothes and shoes into the house, especially if you have an elderly person in the house. The children are actually less, as Wilda said, they are less impacted or affected by the COVID, but they can be. I saw someone who said, is Kawasaki disease here for children? This is a very important issue now. And even in the US, they are seeing more and more children who have not been seen before and now are having some sort of some like a Kawasaki. They're not labeling it now as Kawasaki. They're calling it as inflammatory or multi-system inflammatory syndrome. It looks like Kawasaki. And in fact, here, I'm sure Marianne would bear me out that, yes, we have seen some of those children with COVID positive showing some signs that were associated before with Kawasaki. But it still needs investigation. What I'm saying is, please do not believe anything you read on social media or on anything unless the Department of Health and proper authorities, the PIDSP, the medical societies have put it in their website or in there. And you know, PIDSP has a website, our Philippine Foundation for Vaccination has a website, the DOH has a website. That is where you should get your information, because fake information, misinformation, and disinformation for media people, I hope you don't do that, because that is devastating, that could be deadly, and that could be disastrous. Thank you.
Joyce, can I
Thank
add?
you, ma'am. Yes, Dr. Bunye.
The Philippine Pediatric Society as well as PIDSP came out with interim guidelines on how to manage suspected or confirmed COVID cases in children. All these drugs which are being used right now for adults are considered to be investigational drugs in children. So in other words, pag investigational drugs, you have to get consent from the parents na gagamitan mo nitong mga gamot na to. And you're not even sure if this will be effective to these children or not. And so far, dun sa mga na-manage namin na COVID-positive children, we never used any of those investigational drugs, and all of them recovered with just with just, supportive treatment. Tama si Dr. Bravo saying, anong pinaka-importante? Following infection prevention control measures, hand washing, wearing the proper PPE. And that's it. And then supportive treatment. And you'll never get wrong because these children will get well.
Thank you
Thank
po,
you,
ma'am, sa
Joyce.
mga sagot ninyo. In fact, you already touched on the question of Miss Keds Katsunaga Dayondon, who's a member of the Cebu Blogger Society, yung sa Kawasaki disease in children. For our last few questions, from Richelle Chu, she's a blogger of How to Mommy blog. She's asking, how do we relay to mothers the importance of vaccines at this time when they think nasa bahay lang naman kami, hindi mahahawa ang anak namin sa measles, polio, or other vaccine-preventable diseases? What's the best way to communicate to our mothers right now?
All these viruses are here to stay. May it be COVID, measles, polio. The difference is for measles and polio, we have an effective and safe vaccine. But for COVID, we do not have. At marami pa rin tayong hindi alam tungkol sa COVID. Pero marami na tayong alam tungkol sa measles, polio, pertussis. And let me tell you about measles. Measles is very, smart. Because once it finds that gap or immunity gap na tinatawag natin, papasukan niya yon at yun ang mitya ng infection, ng measles transmission and then measles outbreak. So, ngayon, tama yung sinabi niya, hindi naman lumalabas ano yung posibilidad na makahawa. But, measles is all around us. And the thing about measles is, before the appearance of the rash, yung pwede kang mahawaan nung taong may tigdas na wala pa siyang signs and symptoms ng rash. So that is very dangerous. So as I have mentioned earlier, we have to strike that balance between, protecting the community against COVID and the health workers against COVID, and putting measles and polio and other vaccine preventable diseases at bay by doing immunization or getting those children vaccinated. So sa ngayon kasi nakikita namin na ito na yung pinaka best time to do catch up. This is now actually the direction or the ways forward of the Department of Health. We have to seize this opportunity na kung saan medyo bumababa na yung nakikita nating mga kaso at relax tayo ng konti sa community quarantine. So I think now the LGUs can do catch up with their immunization program at yung sinabi ni Dr. Lulu Bravo, napaka-importante nun. Because you will never know when will be the next wave. Kung merong second wave, third ng COVID. So, importante that we do infection control. Importante that we do hand washing. That is the most effective against COVID and other infectious diseases. In between patients, kailangan maghugas ng kamay. They should wear masks, the healthcare workers. Actually, ito na nga yung pinaplano namin because we have to protect the health workers and the mommies as well. So, we will provide PPEs for our health workers during immunization. And this is now a must in all immunization activities that health workers are protected. So, for immunization program, ways forward is after that 7%, we know we need to do a hell of a job to do catch up, not just for measles, but for polio, as well as other vaccine preventable diseases, pertussis, hepatitis B, pneumonia, and also not just for children but for adults as well. Tama yung sinabi ni Dr. Lulu Bravo. They need to be protected as well, our senior citizens, from pneumonia and from flu. So right now, we are drafting on how to go about with adult immunization. Papupuntahin ba sila sa health center or mag-door-to-door na lang tayo and provide that vaccine for our senior citizens? So all of these are now on the drawing board in the Department of Health because ngayon pareho lang, no? Ang pagbibigay ng immunization, but on top of everything, there is this COVID thing that should, the COVID guideline should be, at the back of our minds when we do draft all of these policies and guidelines for the LGUs to implement.
Thank you, ma'am, for underscoring that our need to do catch up really at this time. We're now down to our last two questions. I think this would fall under Dr. Wilda's expertise, but we can also ask our panelists to comment. The first one, this goes back to the PCV. It says here there is a huge disparity on the costs between the two PCVs available now in the market. PCV10 is perceived to be much lower in cost. It could generate savings by as much as 5 million pesos for the government that can be used to help in our fight against the spread of the COVID-19 pandemic. What can you say about this?
These are the considerations. Kaya nga po, ipinasa po ang desisyon sa HTAC. Because HTAC will not just analyze because let me give you a background. When we did the cost effectiveness analysis for both vaccines, they're both cost effective. The price of PCV10 and PCV13, they fall on that range na cost-effective sila pareho. But of course, there is another benefit when we chose an added benefit when we chose the PCV13 because it contains the 3 serotypes that are not found in the PCV10 before. But now with the new evidence, this was now presented to NIC, the National Immunization Committee, and then it was brought up to the HTAC for further review, and we are awaiting for the recommendation. Yes, that is one, the cost, the savings, as was pointed out, isa yun sa mga tinitignan din na parameters ng HTAC when they come up with a decision or recommendation later.
Just to clarify, it should have been 5 billion pesos pala, ma'am. Not 5 million. 5 billion would have been too low. The last question is
5 billion.
5 billion ang savings.
No, it's
estimate.
5 million.
Billion po, ma'am.
No, not billion because
million.
Yeah, it's million.
Okay.
5 million ang savings. That was presented to us. One of the documents we presented also to HTAC.
Okay. Last question po natin, ma'am. Is it true that the PCV tender is one of the biggest tenders in history? What are the transparency measures that the DOH is doing to ensure that this does not become another Dengvaxia? That's it, ma'am.
Yes, these are new vaccines. Bago kasi itong bakunang to. I know for a fact that what we are giving in DOH, in all of the health centers across the country, is the same brand, the same vaccine that private sector is also administering. So, kala-launch pa lang nito sa private market, and in-offer na rin po natin to kasabayan halos ng private sector. So you can see na hindi talaga mura kapag ka mga bago ang bakuna. Especially kung sila lang mag-isa ang naandun sa merkado. So right now, there are other vaccines, PCV vaccines in development, and one is also, it is already licensed by WHO or WHO pre-qualified. So we are looking into this. All of this, hindi ho kami tumitigil to give the Filipino people, the children, a cost-effective vaccine for the protection against vaccine preventable diseases. And yes, it is a very expensive vaccine, and it's eating up more than 60% of the budget of the national immunization program.
Thank you for that, ma'am. If Dr. Marianne or Dr. Lulu would have anything to add to those questions? Otherwise, we can wrap this up.
What do you mean, add to the questions or add to the
Add
answers?
to the answers, ma'am. Sorry.
You know, Joyce, I was looking over the questions, and there are really so many questions, and thank you for those questions. They're very relevant. One of those is about COVID vaccine, and I just want to say a few words about COVID vaccine. People are really waiting for that, and there are more than 120 vaccines under development in UK, in US, in Germany, even in India. They are really racing against time to get the COVID vaccine. But it will not be here. I'm sure that it will not be here for this year. It could be possibly next year. Wilda mentioned phase 2. Yes, it's undergoing phase 2. I just heard. I listened to CNN and I read literature. And they're saying that, in fact, phase 3 might, in fact, start sometime in August, September. They're now on phase 2. And you know, these clinical trials of vaccines are not easy. But because of the urgency and the emergent nature of this, they might have to sort of withdraw or remove some of the steps that are needed. So it is dangerous also. It's risky. And this is not going to be easy. And, you know, vaccines are developed for years and years and years because you want them to be safe. You want them to be effective. And it should not be really compromised. Safety is the one thing we don't want to be compromised because vaccines are given to healthy people. And now you are having all of this deaths from COVID and all of the high mortality rates from COVID. So it will not come. It will not come. So importante sa atin na talagang sundin yung ating paghuhugas ng kamay, paglalagay ng mask, paglalagay ng physical distancing, at wag pasaway. Oh my God. Sana sabihin natin, ang message natin sa mga tao is, hindi naman sa ayaw ng gobyerno na kayo'y pagtrabahuhin or hindi. Ayaw ng gobyerno natin na kayo ay mamatay sa COVID. Hindi ba? Public health is a must. It's public health that we are trying to defend and we are trying to tell our people. Please, sumunod naman tayo. Huwag pasaway. Thank you.
Thank you, Dr. Lulu, for that admonition. Very timely. Dr. Marianne?
Yes, I'm here. I have nothing more to say. Nasabi na ni Dr. Wilda at Dr. Bravo.
Okay, ma'am. So in that case, I'd really Ayan, sorry. I'd like to thank all our experts who joined us today, our media participants. And to wrap it up, I think it's just important to note that, WHO and UNICEF, they both underscored the need for all governments to begin rigorous planning on how to intensify immunization activities once the pandemic is under control. In fact, they said that at a time like this, countries can ill afford to face additional outbreaks of vaccine-preventable diseases. And the message is very clear. We must not allow life-saving health interventions to fall victim to our efforts to address COVID-19. So again, thank you very much to everyone for joining us in our first virtual kapihan of Samahang Plaridel. And we look forward to having you again in our future kapihan sessions. Stay safe, everyone, and have a great day.
Thank you too, Joyce. Bye-bye.
Hello.
Bye-bye.
Okay, let's have a picture. Let's have a picture.
Ma'am,
Can we have a
bye-bye.
picture? Don't leave. Put on
Ah,
all your
picture
videos.
daw.
Have a picture. I want to have a picture with Wilda. Come on, guys. You want to have a picture, right?
Women power kayong tatlo, ma'am.
Yung iba, yung magpakita, si Chino, si Ann, si Hannah, si Fernando, would you like to put yourselves on the video? I have a full gallery.
wow.
Yeah, here, I'm taking picture. You're all there, but the others
Ma'am,
are
okay
just
lang.
named.
Ma'am, okay lang po for the panelists and for the moderator lang po. Okay na po. Game,
Kasi
let's...
nandun yung names niyo eh, pulos name lang. Ang nakalagay dito, tingnan mo yung panel. I-full view mo. I-full
Mahiyain
view mo.
yata sila,
Makikita
ma'am.
lang, pulos pangalan nyo, walang picture. Di ba?
I'm also
O,
taking
yun,
a picture po, ma'am. Alright, sige. Smile lang po tayo lahat. Okay lang po.
Magpakita kayo lahat. Sus,
No problem po.
Para makita natin, full view. Yung Mary Ann, tingnan mo. I-full view mo yung iyong picture and then we will put out the picture here.
Paano ba yun, ma'am? Hindi ako
I-click mo, ma'am,
marunong.
yung gallery view po sa taas.
Gallery view, full
Upper right
screen.
hand.
Yung dulo?
Yes. And everyone will be seen.
Bago po yung
I will show
enter
you.
full screen.
Ayan?
Yung
I
gallery
will send
view.
you the Viber. I will send it to you on Viber.
Okay. Ayan na, ma'am.
Pulis pangalan eh. Sila Chino, Linda, Miko, Hana, Estrel, Ann, Fernando. Wala, pulis pangalan. Sige, bahala kayo. Ayaw nyo magpakita. Pero maganda yan
Okay
sa
lang po,
website.
ma'am.
Because this could be our documentation, di ba? Wala tayong picture eh. Ito na
Yes
lang.
po, ma'am. Sige, ma'am. I will screenshot
Ito
po.
nga.
She
Chino,
will
ikaw-
also take a photo, ma'am.
Oh,
I'll take a picture po.
Padala mo sa amin ha.
Alright, no
Yung
problem
maganda
po.
picture. Tapos
Alright.
yung kumakaway. O, di ba?
Bye,
Mission
ma'am.
Sige, kaway po lahat.
Bye.
Alright, 1, 2, 3.
Di ba? Ito yung post-mortem natin. Dito lang ako sumasaya eh. Kayo lahat. Pero totoo yan. Actually, I've been learning. Sabi ko nga to avoid dementia. I've been learning this technology. Kaya, Mary Ann, if you like, tapin mo si Chet.
Apa,
Because
apa.
I know it is so beneficial